Omicron is another variant which has exposed inequality and injustice around the world. Some of the countries in the developed north didn't hesitate to impose travel restrictions against the region that did the right thing. And nations affected by those travel restrictions continue to struggle to rebuild their economies. How was this variant detected? Professor Abdul Karim shared the insight.
People will want to rewrite history to make it slant in the way in which it looks best for them. But we know what the facts are, and as far as I'm aware, the earliest report of Omicron on GISAID, which is the international database, comes from our colleagues in Botswana. Without question, they were the ones to first load it up on GISAID. They didn't make a song and dance about it. It was a single sequence, and so they just loaded it onto the system. 2 days later, a second sequence was loaded onto the GISAID database, and that came from Hong Kong on a South Africa, on a person who had come back from South Africa. So those were the two existing sequences on GISAID. Shortly after the Hong Kong uploading, a researcher from the Sanger Institute sent out a tweet saying that he noted these two variants and that they had multiple mutations. But it wasn't until about a week later that a small outbreak occurred in Pretoria among university students, and it just happened that the president of the head of our medical association was one of those that saw one of those patients, referred that patient for a test. And at the laboratory, which is a private laboratory, 6 people were tested from that outbreak. And this technician who did the test noticed something unusual. They use a very specific test called a Thermo Fisher PCR, and she noticed that one part of it was negative. And so she thought something was wrong with the test, so she did it again. And she then sent it for sequencing. So they did, in the private laboratory called Lancet, they did the first set of sequences. When they saw what it was, they sent it through to the NICD that shared it with the National Genomic Platform. Now, I got to see the six sequences when it got to Professor De Oliveira, when he found it and he showed it to me. And that was at least a week after our colleagues had already reported it from Botswana. So that's how the whole story gets about. And we said, we're not going to say anything until we're absolutely confident that this is, really a virus that's spreading. And so we tested. Professor De Oliveira and his team, within a matter of 48 hours, no, not even that, 24 hours, they tested 100 samples, and they showed that 76 of those 100 were the same Omicron variant. That thing didn't have a name. We just, on the phylogenetic tree, we call it, on the B one, is B1.591. So when we saw that, that was the announcement that was made. So it was just that South Africa announced that we were seeing a rapidly growing number of cases of this variant. We weren't the first to actually report it. If others want to claim they were the first to have it or to report it, they're welcome to it. But those are the facts as I'm aware of them.
Africa CDC has expressed displeasure after the move of imposing travel restrictions against South Africa and other countries.
Detecting a variant in a country doesn't mean that it started there. For sure, we need to do some what I call forensic genomic analysis to pin down where it started. But it doesn't really matter. What matters is that you pick it up, you reported it, and then the world did something positively with, you expect that the world would use that information positively to continue to fight this pandemic. We are acting with this Omicron as if it is the last variant, and it will not be the last. Prof. Karim said it very well. It is not going to be that. I'm not a prophet of doom. I said this months ago when we were all focused on Delta as if Delta was the last thing that we ever see that. And I said, and Sophie, you recall this, we've discussed this during the Thursday's conference, press conferences all the time. I said, I just want to be very clear, there will be a food wave, there will be a feed wave, there will be many more variants that you can. So what should really be the centrality of our conversation is how do we deal with the variants? How do we communicate with the variants? How do we have policies that will not enable us to panic and then create further distrust across all of us as humanity so that we can tackle this virus in the most appropriate way?
The variant has since spread to many countries around the world, particularly in Europe and the United States of America. As the issue of travel restrictions continue to dominate the headlines, many countries are saying this will have a negative impact on the global economy at a time where the United Nations has appealed to member countries to rebuild back better. Sophie Mkwena, SABC News, Johannesburg.